really fairly low. We raised it to $1.36. Illinois is at 98 cents. Wisconsin actually just went to $2.52
Really?
in state taxes. So they're way ahead. But yeah, we've seen a substantial decrease just in this last 2 years in the number of kids taking up smoking, and actually the number of adults quitting, because a package of cigarettes is approaching $7 in Iowa, and that's very pricey for folks. So it was a tax issue. It raised about $130 million, all of that money went back into our state health care programs to take care of people on Medicaid and to provide smoking cessation to help people. We're going to charge people more money to smoke. Yeah. We ought to help them quit. And so some of that money has been invested in helping people actually kick the habit.
Great, great. Now, that's one of the health issues that you've been involved in, but you're also on a broader scale involved in some healthcare issues. Talk about that a little bit and your involvement in the national scene.
Sure, I'd be happy to, Jean. Well, as viewers know, we've been engulfed in a major debate in the country about how to improve our healthcare system, and this massive healthcare reform effort that's underway, that's being led by the President and members of Congress. Over the last couple of years in Iowa, we've made some progress as well, and so and that progress has been around trying to provide coverage for all Iowans. And I served on a health care commission over the last 3 years, a state commission that looked at how we can try and get coverage to about 50,000 uninsured kids in our state and about 250,000 and growing number of uninsured adults. And this commission made a series of recommendations, some of which have been enacted by the legislature. And probably the thing that we're most proud of over the last couple of years is a commitment that was made in a broadly bipartisan way with support of Governor Culver to invest about $25 million over a 3-year period in providing access to health insurance for every Iowa kid under 18 years of age. And we're arguably the only state in the country at this point that is on a path to providing coverage for all their kids. And so we're really proud of that, and we made the 3rd-year investment in that program this year. Where we're challenged is with these 250,000 and growing number of adults without health insurance, 80% of whom work full-time. We just don't have the capacity as a state to come up with estimates of, say, $800 million to $1 billion to provide access to health care, because most of the folks in this category are, as I said, most work, 80% work full-time, just don't make the incomes to provide, to pay for the health insurance that might be offered by their employer. They work for employers that simply can't afford to cover them. And without a real strong federal partner in this national effort to help, and Iowa's not alone, most states don't have the capacity to provide coverage to people that don't have it. There's also a group of people, families and individuals, that have coverage that simply are unhappy with it. They can't afford the kind of changes that are made year to year when a business has to shop for a new policy because they've been priced out of the market in the policies they have. So we have a lot of people that are struggling to keep their insurance. We have a lot of small businesses dropping coverage to their employees, or employees foregoing any kind of wage increases because their employer says, well, we can give you a wage increase, but we can't afford the health care, and the health benefits and the benefits are really important to families. So people are saying, no, let's keep our health care, we'll forego the pay increase. And so over the last decade, workers' wages in Iowa and really across the country have been wage increases have mostly been absorbed by the increasing cost of keeping benefits. And so this federal reform movement's really quite important to helping Iowa. So this summer I've served on this committee of state legislators around the country, White House group of state legislators. We've had a conference call every week since the middle of June when we visited the White House to talk about how we at the state level, kind of in the trenches of trying to move policy and try and experiment with things in the states, how we could give advice to the White House about what's working in our states. There's about 40 legislators that have been involved with this, and we continue to have weekly conference calls to better understand what the administration's principles and objectives are, as well as share information about what we think might work.
Are you optimistic about our chances of getting a national health care reform?
I am optimistic. We're here in early September, and I think with Congress coming back to work, that the President and the administration and the leaders of Congress see that this issue's got to move forward. Status quo, just simply not doing anything, is bankrupting businesses, families, and frankly the competitiveness of the country looking ahead without any kind of reform. So I think the pressure's on. This is in that we are going to get federal legislation, meaningful federal legislation, that's going to begin to change the course of this system.
Mm-hmm. Mm-hmm.
So I'm optimistic. There's certainly a lot of work to be done before now and the end of the year to make that happen, but the stakes are too high just to let this fall away.
Right, right. You know, everybody who goes through high school, I think, reads the textbook about how a bill becomes a law. And people who have been there know that that is an oversimplification of what really happens. Do you have a specific piece of legislation that you have worked on that you could trace through, walk us through what has happened in the process of getting that legislation adopted? Give us kind of the nitty-gritty of what you have to go through.
Well, in general, Jean, as you know, there's a number of stakeholders in any piece of legislation that comes forward. And you know, over at the State House, we certainly have our constituents here in Iowa City. Many times they come to the State House to lobby. And then you have the professional lobbyists in Des Moines who represent all the organizations in business groups and some nonprofits. Groups like the credit unions have a lobbyist, the bankers have a lobbyist, the League of Women Voters has a lobbyist, the utility companies have lobbyists. So depending on the issue, you're likely to get a lot of feedback from all sides of a particular policy question, and that's a really important part of the process. There are sometimes issues that come along that people in the lobby don't agree on, and whether it's scope of practice between chiropractors who think physical therapists shouldn't be able to do a certain thing, and then a bill comes along that says physical therapists should be able to do a certain kind of treatment, and the chiropractors say, well, no, not really, because it's infringing on what they do. It's frequently you'll want to get the chiropractors and the physical therapists and their lobbyists to sit down and resolve the dispute so that the legislators aren't in a position of either choosing one. Sometimes we have to choose, but we frequently want to get to compromise by having people that work on these issues, understand these issues, work day in, day out with these issues, come to some sort of resolution and bring it to us. If that can't happen, sometimes bills, in this example, bills will get passed or they'll get set aside and say, you just keep working, we're not going to pass a bill until. One good example that was the bill a year ago dealing with smoke-free workplaces. A bill that I worked on with a number of other leaders in our caucus and in the House, and it was a legislation that was unlikely to move forward. Most states that had passed statewide workplace smoking bans had seen local ordinances that started the process. A city would pass it, another city, and soon the state would have 5 or 6 cities or towns that you couldn't smoke at workplaces. Iowa was the first state where we skipped over that process and went immediately to a statewide ban. And so in 2008, the bill was introduced to do that, and it was uncertain whether it was going to move forward. It kind of got this trajectory and some momentum behind it, and the Iowa House passed a bill that would have allowed smoking in casinos, the Senate passed a bill that would not allow smoking in casinos. And so we went through a dance between the House and the Senate where the bill went back and forth a few times.